Hey everybody and welcome back to my channel. Today we are going to be talking about von Willebrand's disease. First of all, what is von Willebrand's disease? It is a deficiency of von Willebrand's factor, which is contained within the viable Palladi bodies of endothelial cells and alpha granules, then platelets. Now, what happens when there is a breach in this in the continuity of the endothelium is that viable Palladi bodies are released from both these areas and the subendothelial collagen gets exposed. Then what happens is that because of shear stress, there is going to be multimerization of von Willebrand's factor, which then acts as a bridge between GP 1b of on the surface of the platelets and the subendothelial collagen. This is the first step of platelet adhesion in forming a primary hemostatic plug, right? Now, there are different types of deficiencies with von Willebrand's factor. The first one is a qualitative deficiency. The second one is a quantitative deficiency, and the third one will be acquired. Now this one I have already covered in a different video under colonic angiodysplasias, so I highly recommend watching that video. It is a really good one and you will get a better idea of acquired von Willebrand's disease from that one. So how would now you need to also remember that this quantitative and qualitative deficits of von Willebrand's disease, they are usually autosomal dominant disorders, right? Now, how would von Willebrand's disease present? It usually presents as platelet dysfunction. So the first thing that you want to remember is that in females it presents with heavy menstrual bleeding and possibly anemia because of the heavy menstrual bleeding, right? It presents with mucosal bleeds like epistaxis that lasts longer than 10 minutes, and recurrent epistaxis, right? Another one would be post-incisional bleeds. Post-procedural, post-surgical, what have you. It can also present with bleeding after circumcision in small boys. Bleeding after circumcision. Then the last one is worsening of symptoms after ASA use. Okay, now that is the presentation. Now, how do you go about diagnosing von Willebrand's disease? So first I want to start by talking about two kinds of tests. The first one is the von Willebrand factor antigen test, which is a quantitative test. And the second one will be a von Willebrand factor. It's the ristocetin cofactor assay, which is a qualitative test. So what happens in this antigen test is that you're checking for the total von Willebrand factor protein in the patient's body, and in the ristocetin cofactor assay you're checking for the functional capacity. It's a functional test of von Willebrand's factor, right? Now, how does the ristocetin cofactor assay work, right? So ristocetin is a chemical that causes von Willebrand's factor and platelets to clump together, okay? So what we are going to do is we are going to take patient blood and it's going to be mixed with a predetermined amount of ristocetin, right? And that is going to be then added to formalin fixed platelets, and the platelet aggregation is going to be measured via flow cytometry. So basically you want the platelets to aggregate for a normal result, right? So this is the ristocetin cofactor assay. One more thing that you always have to remember with von Willebrand's factor is that it acts as a carrier protein for factor 8. And it also stabilizes it. So the factor 8 assay will show decreased activity in case of von Willebrand's disease. And also there's going to be elevation of PTT because of the decrease in activity of factor 8. There's going to be increased in bleeding time because you're taking longer to form the hemostatic plug. So that those are the last test that you can do is a genetic analysis to come to a diagnosis of von Willebrand's disease, right? So how do you treat von Willebrand's disease? The first one would be desmopressin. This increases both von Willebrand's factor and factor 8 levels in the patient's body. Oral contraceptive pills can be used for patients with heavy menstrual bleeding to regulate menses. In some cases of mucosal bleeds, antifibrinolytic agents like aminocaproic acid and tranexamic acid can be used to stabilize clots and stabilize the bleeds. There is also replacement of von Willebrand's factor or factor 8 or a combination of the two, right? Replacement of factors for patients with von Willebrand's disease. So this is pretty much everything that is tested on the boards with respect to von Willebrand's disease. I hope you all have a good idea about how this shows up on the boards, and that you've gotten a clearer idea about the disease manifestation and pathogenesis itself. Please let me know in the comment section below if you have any specific questions or you have any specific videos that you want me to cover. Thank you so much for listening. Good luck and have a nice day. Bye-bye.